As our population ages, the number of people living with dementia is on the rise. Living is the key word. Cities and towns are now rethinking how to make their public spaces more friendly to those with dementia and Alzheimer's so people can safely enjoy life. In Nova Scotia, Ross Lord met a class of young designers making it their mission to help.
For Marilyn Taylor, living with Alzheimer's disease means a series of adjustments. Using shatterproof dishes to compensate for declining motor skills is easy. Other things are hard. She doesn't drive and relies on transit buses to get around Halifax, often losing her way.
You're easily confused at night, especially. The signs have lost their fluorescence. You can't identify what they are at night anymore.
After sharing her experience with students at the Nova Scotia College of Art and Design, they went to work, designing transit signs that light up at night, adding more color, and including a triangular shape on the bottom to make them easier to identify.
So here you see the number 1 and 7. That could easily be mistaken for the number 17 bus route, if that even exists. This way, every grid or every bus route is on its own square. That way, you can distinguish one from the other, and there's no way it can be confused.
Marilyn likes what she sees.
You can spot all the different numbers instead of them going together.
The design students also created this, called a sensor bag. It would help mid-stage dementia patients calmly touch soft material without feeling self-conscious.
Discreetly hide your hand within the bag. So it gives it a little bit more dignity.
Right.
And
so
it
hides
it.
Comfort without appearing obvious about it.
Yeah, exactly. Yeah.
There's also an ID tag, so members of the public can contact a caregiver if needed. They've also developed plans for a green zone for late-stage dementia patients, greenhouses that provide more sunlight in nursing homes and a comforting space. It's an assignment the students embraced.
My great-grandmother and my grandfather have both had Alzheimer's disease, so it was really great to actually work with something that a lot of the community has to deal with.
Their audience, the Alzheimer's Society of Nova Scotia, says the project has potential. If adopted, the ideas might make the outside world a bit less intimidating. Ross Lord, Global News, Halifax.